All right, Mr. Kumar, what are the pain points of the healthcare sector at present?
A couple of pain points are healthcare is all about sick care and not really about healthcare in India. Number two, I think the investment in healthcare is abysmally low. So it's just about 4% of our GDP, and the government spend at 1.3% is even lower. And most of it gets spent on salaries, on running infrastructure programs, and the other healthcare programs. Very little investment takes place on the technology aspect of it. Then healthcare is not really accessible to all. So we really have two countries within India, India and Bharat, and the vast majority of rural masses do not have access to quality healthcare. Then again, the healthcare cost is very prohibitive, so it's really not affordable. As a result, people normally go for over-the-counter medicine, self-medication, or they go to quacks, which really end up spoiling their health. Then we also have issues with respect to skill sets. So really, we really not doing much to upgrade the skill set of the healthcare workers. And finally, things like emergency response system is pathetically low. So while we do have turnaround times and SLAs for delivery of pizzas, for delivery of letters, yeah, but we really have none for regulating the movement of ambulance as an emergency services. I think these are some of the concerns which we are facing around healthcare today. And the need of the hour is for the government to come out with a comprehensive policy, with a clear-cut vision on what the healthcare should be in India, and how can the various stakeholders be aligned to achieve that mission, and how can we really have an integrated policy by looking at the needs of the patient and not looking at the needs of the healthcare providers. I think that's very important, and also for the government to centrally look at all the entire continuum of healthcare under one single ministry, rather than leaving it fragmented under different ministries. I think that's really very much required. And again, technology can be brought in over here in a much big way to not only spread awareness about healthcare, but also to make sure that we are able to deliver quality healthcare through the involvement of technology. And again, finally, the focus should be on lifestyle management and on health management rather than just on the sick care. And for this, India has something like 900 mobile users, 200 internet users. I think that's a very strong platform through which we can spread this awareness amongst the population in the country.
Right. You spoke about accessibility and affordability, that being the major challenge. Do you think FDI in healthcare has helped the sector?
Well, not really so much, because there again, see, let's take a look at it. About 25% of our hospitals are today catering to the needs of just about 7% population. So they are located in those cities where only 7% population resides. There again, out of the 7% population which resides in the city, that healthcare facility is not really available to the underprivileged. So it's catering to the needs of just a select few handful of population. So FDI, I would not say is really contributing towards an inclusive growth of healthcare segment, nor is it helping to take healthcare to the masses, to the bottom of the pyramid. And this is in spite of the fact that India is the largest manufacturer of patented drugs. And also we have one of the best brains in terms of doctors, and many of these doctors today are now actually working abroad. So that's really a brain drain. Whereas on the other hand, we also have India as a very large destination for medical tourism.
So what can be the challenge? I mean, what is the solution for this particular gap? How can we go ahead and overcome this gap?
We need to first and foremost have a very strong national health policy which encompasses the various stakeholders and which encourages public-private partnership with government as the payer and the private players and the real medical service providers providing services to the grassroots level. Then bringing in technology, and by technology we not only provide care to the people, but we also maintain the health record of the population, and we also use this health record to improve the quality of healthcare services that we can provide to the people in India.
Using data, cloud and analytics.
That's right. I mean, those are, and again I would say telemedicine is very important tool. So if patients can't reach the hospital, we must learn to take the hospitals to the patients, and for that I think there is a very heavy investment that should be required in terms of improving the networking across the country, in terms of imparting e-literacy, also in terms of having qualified people who can really manage the telemedicine aspects. I think all this put together will really bring about a paradigm shift in the way we look at healthcare in the country.
All right. Your thoughts on Swasth Bharat to achieve Sabka Vikas?
Very important. Swasth Bharat is a very important concept, but we must now walk the talk. So healthcare should be taken very seriously. It is extremely important. We talk a lot about economic development. Now we must understand that economic development can be delivered only by a healthy nation. While the economic growth in the last about 14 years has been cumulatively 14%, the investment on healthcare has been just about 12%. Yeah. Now that speaks volumes about the focus that we are providing to healthcare. You look at some of the advanced countries, the healthcare spend over there is about 10% of the GDP. In India, it's just about 4 to 5%. Government spend is as low as just about 1.3%. So I think this speaks volumes about the interest that we are taking in investing in the healthcare. I would in fact like to take this discussion even a step forward. Healthcare is just not about only healthcare delivery. There are so many other aspects which are related to it. For example, environmental management, sustainability procurement. These make sure that the environment stays healthy as a very important conductor for making sure that as a proactive measure the population stays healthy. I think these are very important aspects which all put together will contribute a great deal towards promoting the concept of Swasth Bharat.
All right, just a last question here. What is Ricoh's involvement in the healthcare sector, and is there any corporate social responsibility in healthcare?
So Ricoh is involved in healthcare in a big way. So let me explain this. We have three main business domains in Ricoh, which are imaging, IT services and communication. Now using all these three business domains, we are able to come out with specified solutions to meet the unique needs of customers in each of the industry verticals across our economy. And these are our focused industry verticals, healthcare being one of them. So it's a very important vertical that we are focused upon, and we are able to come out with unique solutions which can really improve the quality of healthcare for the population of the country. So therein lies the involvement of Ricoh in the healthcare segment. And so far as the corporate social responsibility is concerned, Ricoh has been taking initiative of reaching out to masses in the rural areas to get them to avail of the healthcare facilities, as well as by promoting some of the healthcare initiatives to the underprivileged sections of the society.